Your doctor gave you a cortisone shot. It felt great for about 2 weeks and then it wore off. Sound familiar? You're not alone. Millions of people get cortisone injections every year, and millions of people wonder why the pain keeps coming back. Here's what most doctors won't tell you. Cortisone is an anti-inflammatory steroid. It reduces swelling, it numbs the pain, but it does not heal. And here's the kicker. Repeated cortisone injections actually accelerate cartilage breakdown. Multiple studies have confirmed this. Now compare that to PRP, platelet-rich plasma. PRP uses your own blood, we concentrate the growth factors, and we inject them right where the damage is. These growth factors stimulate actual repair, and they recruit your body's own healing cells to the injury site. Clinical studies show PRP outperforms cortisone at 12 months for knee arthritis, not just in pain relief and in function, also joint health. One masks the problem, and the other addresses the root cause. If you're tired of temporary fixes, book a consultation. Link is in the description, and hit subscribe so you don't miss the next video. Thanks.